Hello everyone, and thank you for attending today's webinar. Before we begin, we'd like to cover a few housekeeping items. At the bottom of your audience console are some application widgets you can use. You can expand each widget by clicking on the maximize icon to the top right or by dragging the bottom right corner of the widget panel. This webinar is being recorded, and the recording will be available one day after the webcast using the same audience link. A copy of today's slide deck and other resources are available in the resource list widget. It's a green folder at the bottom of your screen. If you have any questions for presenters during the Q&A session, click on the Q&A widget and submit your questions. We will try to address as many questions as possible during the webcast. If we run out of time, your question will be answered later via email. We do capture all questions. If you have any technical difficulties, please click on the Help widget. It has a question mark icon and covers common technical issues. You can also commit technical issues through the Q&A widget. Now I'd like to introduce Nikki Aikens. Nikki, you now have the floor.
Good afternoon, and thank you for joining the REL Mid-Atlantic today for our discussion about the recent report focused on transforming the financing of early care and education with a highly qualified workforce. The topics of qualifications and compensation for early care and education teachers are important to practitioners and policymakers alike, and we're eager to share the findings and recommendations from this work with you. My name is Nikki Aikens, and I'm a senior researcher at Mathematical Policy Research. I'm leading several early childhood projects for the REL Mid-Atlantic. I'm pleased to have two presenters join me today. Kathy Glazer is the president of the Virginia Early Childhood Foundation, and Harriet Dichter is a fellow at ICF Inc. Both were members of the National Academies Panel on transforming the financing of early care and education. Kathy and Harriet will provide insight on the recent research and recommendations in this area and about state experiences implementing related policies. We have three primary goals for today. We'd first like to highlight recent research and recommendations from the recent National Academies report focused on financing early care and education with a highly qualified workforce. We'll also share potential state strategies for implementing the report recommendations. And then finally, we hope to answer questions you may have related to the report recommendations and the potential policies that align with those recommendations. Both the field and policymakers recognize that early care and education providers should be well qualified, meaning there is an understanding that there are certain knowledge and competencies that teachers should possess. There are questions both about how best to support and strengthen the competencies of ECE providers and how to finance ECE so that it is accessible, affordable for families, and of high quality, including having providers who are well qualified. Two recent reports explore these issues. The Transforming the Workforce for Children Birth through Age 8, which was prepared in 2015, and also the Transforming the Financing of Early Care and Education report released earlier this year. Today we'll focus on the financing report, which builds on the earlier report on transforming the workforce. So here's our agenda for the webinar. Before diving into the content, I'll provide a very brief overview of REL Mid-Atlantic and the types of work we do on behalf of states and districts. Then I'll turn it over to Kathy and Harriet. They'll tell us about the findings from the Transforming the Financing report on financing early care and education, and they'll also describe potential strategies for states seeking to implement those recommendations. Altogether, we will present for just over an hour, and then we'll have time for Q&A. As a reminder, you can submit your questions using the Q&A tool at any time. You do not have to wait until the question and answer session to submit your questions. The REL Mid-Atlantic is one of 10 regional educational laboratories across the U.S. funded by the Institute of Education Sciences, which is an independent, nonpartisan entity within the U.S. Department of Education. The purpose of REL Mid-Atlantic is to work directly with the states and districts in Delaware, the District of Columbia, Maryland, New Jersey, and Pennsylvania to help build their capacity to interpret and use data and research to address education problems. Each REL's work is driven by the needs that states and districts in each region have. We provide support in three ways. First, through dissemination of existing research knowledge. Second, training and coaching around the use of data or research. And third, conducting research studies to gather new evidence. And then we share our findings so that other agencies across the region and the country that are thinking about similar sorts of topics can benefit from the work. As much as we can, we like to post our work and resources from other RELs on our website so that they can be shared and used. This slide shows the link and a screenshot of the home page for the REL Mid-Atlantic website. We encourage you to visit it frequently and use it as a resource for your work. I will now turn it over to Kathy and Harriet, who will walk us through the recent work conducted by the National Academies. The recommendations that they will share do not necessarily reflect official positions of the REL Mid-Atlantic or of IES, but instead they are a result of the contributions of expert panel members, as they will describe shortly. Kathy?
Thank you, Nikki. It's a pleasure to be with all of you today and review some of the findings from the report. I'd like to first acknowledge the sponsors of the study, the organizations and agencies listed here that were committed to having these important issues and questions addressed in a thoughtful way. I'd also like to recognize the experts and the individuals, our esteemed colleagues who joined Harriet and me as members of the study committee under the leadership of LaRue Allen, who served as our chair. The committee was charged with reviewing the available research on the resources needed to meet the true cost of high-quality early care and education and studying how to fund accessible, affordable, and high-quality ECE for all children from birth to kindergarten entry and consistent with the vision that was outlined in the 2015 Academy's report, Transforming the Work. Specifically, the committee was asked to address 6 key questions. 1, what changes need to be made to the funding structure in order to ensure that funds are available to support quality care? 2, how can a reasonable share of costs for families be determined? 3, what funding mechanisms at the federal, state, and local levels have been effective in supporting the ECE workforce? 4, what promising funding mechanisms at the federal, state, and local levels warrant further examination? 5, what other workforce development considerations affect the effective implementation of these funding mechanisms? And finally, 6, what frameworks or tools can support national, state, and local systems to develop funding mechanisms? The vision you see here stated, and to achieve the high-quality practice that we know leads to the child outcomes desired, transforming the workforce for children birth through age 8, the original report called for high-quality professional learning to support the knowledge of practitioners and administrators, practice environments and working conditions that provide the resources and tools needed and that support the well-being of practitioners, and supportive policies for both professional learning and the practice environment. And just a reminder that all of this is driven by the science of child development and early learning and supported by systems for continuous improvement. Just a word about our process. The study began in December of 2016, and the committee met in person 4 times over the course of just over a year to develop the approach to the study, plan for information gathering activities, carry out interpretation of the information that we gathered, and to deliberate. We used multiple mechanisms for gathering information over the course of. And just a word about some of the key terms that were used throughout the report and will be used throughout this presentation. Because of the report's charge on financing, the committee focused on paid non-parental care, which occurs, of course, in a variety of settings, including centers, homes, and schools. These settings also vary by type. Some are publicly funded, some are private market-based centers or homes, while others rely on a mix of both public and private funding. Early care and education workforce in the United States is comprised of nearly 2 million practitioners working in settings, and that includes educators like lead educators, assistants, and aides, as well as administrators and coaches and mentors, etc. And in terms of financing mechanisms, we're looking at the method by which the funds are distributed to entities. So, for example, provider-oriented financing mechanisms would include grants or contracts to service providers, such as Head Start program funding or state pre-K. Secondly, family-oriented financing mechanisms, which include vouchers and tax preferences. Third, workforce-oriented financing like scholarships or pay. And fourth, systems-oriented mechanisms, statewide quality rating, assurance systems, and professional development. The committee focused much of its analysis on these financing mechanisms because we found that the ways in which and to whom funds are distributed can have an effect on which children are served, which families benefit, and whether the care delivered, as well as, of course, affecting the well of the ECE workforce. As we all know, financing for early care and education in the United States is a layering of separate programs with different funding streams, constituencies, eligibility requirements, and quality standards. Funding from the public sector currently amounts to about $29 billion, and that includes the major public early child care and education programs, Early Head Start, Child Care and Development Fund, and state-funded pre-K. We also have funding from private sources. Of course, among private funders, families themselves bear the heaviest burden, paying about 52%. Other private sources are philanthropy and employers, and that represents a piece of the pie. The committee drew from the original Transforming Report and the Science of Learning to establish 6 principles which guided our work, especially in judging the existing financing mechanisms that make up the current fragmented structure. I'd like to review those 6 principles with you, as well as give a hint of some of the challenges that the committee found in our examination of the current system. So the first principle stated here on relates to the goal of promoting a highly qualified workforce. For the ECE workforce to be well qualified, educators and staff need to be well compensated, have affordable opportunities to access, and receive appropriate ongoing support and professional development. And though various programs and financing mechanisms have been used to supplement practitioners' wages, their overall compensation and the temporary nature types of supplements does not create the predictable and steady salary necessary for recruiting and financial supports for ongoing professional learning and higher education provided only on a basis. Financing is then largely absent for system-level improvements that higher education programs prepare students with the knowledge necessary to work with young children. Without proper investment to programs, financing to support the pursuit of higher education for the ECE workforce may do little to improve the quality of ECE professional. The second principle addresses affordability.
Excuse me, Kathy, your phone is going in and out. Can you please speak up a little bit so everyone can hear you?
Sure. Thank you for letting me know. The second principle addresses affordability and equitable access. The current financing structure does not enable equitable and affordable access in that families pay approximately 52% of the total cost of ECE. Families with the lowest incomes spend about 20% of their income on ECE, while families at the highest income levels pay only about 6% of their income. Even for those families that qualify for subsidized programs, many are not receiving assistance due to inadequate funding. And finally, financing mechanisms are not harmonized. Head Start, state child care assistance programs, and state-funded pre-K programs tend to target resources to low-income families, while tax preferences benefit middle and upper-income families. This lack of harmonization leads to gaps in ECE affordability for low-income families and underutilization by middle-income families. Provider-oriented and family-oriented mechanisms have the potential to promote quality. However, the existing quality standards and the effectiveness of their implementation vary across financing mechanisms and programs. Typically, receipt of funding is not directly linked to attaining or maintaining quality standards and does not offer incentives for attaining high-quality early care and education. Levels of support to providers and to families are rarely based on the costs of offering high-quality ECE services and therefore are insufficient to drive quality improvements. Many providers lack secure funding that would allow them to maintain stable operations and invest in quality improvement. Turning to principles 4 and 5. First, in working to ensure service delivery options that are high quality and financially sustainable, the committee considered the viability of both provider-oriented and family-oriented financing mechanisms and recognized the potential trade-offs involved. Most provider-oriented financing is currently directed to center-based providers, and offering care during non-standards hours, for example, is generally not cost-efficient for most centers. Families who need care during these hours then may find it difficult to secure affordable quality care that meets their needs. Provider-oriented financing could, however, incentivize providers to offer services during non-standard hours. And similarly, provider-oriented financing varies in the duration of services supported, but could be supported with adequate funding in order to require or incentivize providers to offer services for longer durations, better meeting the need for some working parents. While family-oriented mechanisms give families options regarding program location, hours of operation, and approaches to child development, this choice could be subject to restrictions set by the program, and families may choose to purchase care that maximizes convenience of location, and this convenience could then come at the expense of choosing quality programs for child well-being and development. As to Principle 5, building and upgrading facilities are often overlooked elements of a quality infrastructure for ECE, and providers need funds for acquiring new facilities and for maintaining, expanding, and improving existing facilities. There are several provider-oriented and family-oriented mechanisms to support facilities, including loans, grants, tax credits, and community development financial institutions. Yet without a consistent and effective financing system for physical infrastructure improvements, providers are forced to pursue piecemeal financing approaches, which are often insufficient to meet the need. Currently, no system-wide approach exists for providing support for building and improving ECE facilities. And finally, Principle 6. Improving the quality of ECE also requires a robust and coordinated system of data collection and management, monitoring, and assurance and improvement systems. The system must include components of data collection, management, licensing, monitoring, and regulation, and then accountability systems. Currently, the financing supports for this type of system-wide quality improvement are limited and often not sustained. Resources for quality improvement within existing funding streams are not specifically earmarked for quality improvements or provided at high enough levels to effectively incentivize and promote quality. While quality rating and improvement systems, for example, are commonly used, they vary greatly between states and are limited in their capacity to support and reward workforce supports for developing a highly qualified workforce. Now I'll turn it over to Harriet.
Thank you, Kathy, and thank you, everyone, for participating in today's panel. So I'm going to tackle the next big part of our presentation, and in this section I'm going to talk a little bit about our cost estimate that we built, as well as our consensus recommendations. And when we get to the consensus recommendations, you'll hear that there are 10 of them. And those are really consensus recommendations, and they stem from the procedures that underlie all reports from the National Academies, which do uniformly call for consensus recommendations. And recommendations are to be based on objective, nonpartisan advice using scientific and technical evidence. So let's take a look first at this slide that's talking about estimating the cost of high-quality ECE. So one of the issues that we had to tackle as a committee was looking at what would go into our cost estimate for a high-qualified and well-compensated workforce. And we had to make a number of assumptions, and you can see as you take a look at this slide that we made assumptions in 2 levels of planning. The first was on-site costs, and the second was system-level costs. For the on-site costs, we wanted to pay attention basically to elements, some of which exist in some settings and some of which actually don't exist in many settings, that would be uniform for places where children are receiving services. So our estimates take a look at issues such as the staffing levels and structure, the staff qualifications and compensation, the on-site professional responsibilities and learning time for the staff, and more granularly, that means that we accounted for staff to have time to do planning and not to be spending all of their time teaching or trying to do their lesson planning while children were sleeping, the operating hours and days, and finally facilities and other non-personnel costs. At the system level, we needed to account for costs such as workforce development and quality assurance and improvement costs. So we do see the pieces as interactive between resources and supports that are needed within programs, as well as things that are more systemic that are helping to infuse quality for the system as a whole. I wanted to then take a look with you to go a little bit deeper, basically into some of those specifics that we came up with that are important at the program level. And these are really grounded in the core report that we used as our standard or baseline in our work, which is the Transforming the Workforce report that Nikki mentioned at the very beginning, as did Kathy. And so based on that report, we have made several critical assumptions. The first is that our lead educators will have bachelor's degrees. The second is that we will have resources at the site level for coaching and mentoring, that those are baked into the budgets and how things work at the operational level. Third, that we would have paid release time for professional development. Next, that we would have specialists available who would be able to work with and support staff who are working with children with special needs. And last, as I already mentioned, that we would have paid non-child contact time, things such as planning. So those are pretty critical assumptions as we're thinking about what does it take on the ground, and we wanted to make sure that everyone understood what assumptions we used going into the cost calculation. Our approach basically that we built also includes a period of transitioning, and we talk about this as a 4-phase transition a little bit later. We have some slides to show you about that. But in order for us to get to these transitions, we generated 2 different types of cost models, and I want to explain them to you so you understand what we did. We'll be dwelling for most of our discussion on the dynamic, the second cost model. But in this chart that you'll see here, this is a pretty simplified approach to how we generated these cost models. And if you look across the top row of this particular slide, you will see what we call the static estimate. The static estimate, this is the most important thing to understand about it, is based on current utilization patterns for children, which have been disaggregated by family income, child age, and type of setting. And these were taken from the National Survey of Early Care and Education. In this particular layout for the static cost estimate, current hours of ECE use were multiplied by the estimated cost per hour for high-quality ECE, which also differentiated by child age and type of setting. That produces a static estimate of the total cost of high-quality ECE for our country. Based on assumptions about any family payments needed to cover those costs, we then can have an estimate of the remaining costs that would need to be covered by public sector subsidies. Looking below, horizontally across the bottom, you can see the dynamic estimate. So the dynamic estimate is very similar, but it reflects what we are thinking of as changes in behavior that we would expect to occur as the system changes. And so when you take a look at the bottom half of the diagram, there are 3 important ways that we adjusted assumptions about the utilization patterns that relate to what we think might happen with our families. The first of these assumptions is that we would expect participation in ECE to increase because more families would choose to have their child in an ECE setting. And that is because overall more resources would be available to families to be able to allow them to afford to purchase early care and education. Second, we expect some modest shifting from home-based ECE to center-based ECE, especially for infants and toddlers. This is based on what we know best from the data we have now that shows, for example, that when we do subsidize families who have infants and toddlers, they do tend to shift care from regulation exempt or family settings to center-based settings. This is not to say that we are getting rid of these, getting rid of this type of care, but more that there's some modest change and we wanted to account for it. And then the third change here in the dynamic estimate is that we would expect that families might increase their weekly hours of use. So these are kind of assumptions that we use to build the static estimate, which I want to go on to talk a little bit more about now. So when we take a look at our next slide for the static estimate, there are a couple of things I want to draw your attention to. This is a very busy slide, and so I know taking a look at it first could be confusing. But this table represents our dynamic estimate of the annual cost of ECE in billions of 2016 dollars over these 4 phases of implementation. And if you take a look at the top row where it says total dynamic estimate, and you go all the way over to phase 4, this shows you that to implement based on the assumptions we used would have a total cost of about $140 billion per year. The table also shows, and this is in the last 2 rows, where it says center-based and home-based, basically, how much the total cost would be associated in these settings and how that would evolve over the course of the 4 phases. And so what you can see is some shifting in terms of the pattern of expenditure between center-based and home-based care. So you end up with approximately 75% of the resources in centers and approximately 25%. The other thing that I would like to say about this estimate, because this often comes up, people have asked us, does the salary that we use to get to the $140 billion, how does that really take into account educator wages? And for those who have studied up on different ways of categorizing these issues of the compensation levels for educators, we used what would be characterized as sub-parity. If we were to have used full compensation parity for the educators, it would increase the total estimate here by approximately 10%. So we did improve in the model the compensation levels for the educators, but it's not really full parity with our public school teachers teaching in the lower grades. In this next slide, I think we're trying to help answer the question is, what does $140 billion mean? One of the things that we know is you can look at this number and say, that seems like a big number, that seems like a reasonable number, that seems unreasonable. So this slide is our way of trying to give context to why we think this is a number that we shouldn't shy away from and that we should all feel perfectly good about talking about. And so in the top part of this slide, we took a look at OECD countries. And using, again, the dynamic estimate, you can see that in OECD countries, they're spending an average of 0.8% of their GDP on ECE. In phase 1, we're at 0.4%. And when we get up to full implementation, we're still less than the other countries in the OECD. We're at 0.75%. So we think that's a good benchmark for understanding part of what this number might be. Another way to think about this is to look at what this might look like relative to the comparable share of K-12 spending for our children. And so in this, we can see that the estimated total cost of high-quality ECE amounts to only about 12% of total K-12 expenditures in phase 1 and rises to about 22% in phase 4. That is, expenditures for 1/3 as many children of age 0 to 5 years compared with children of ages 6 to 18 years will cost only from 1/7 to 1/5 as much. Now let's talk a little bit about sharing the costs. There are a lot of different ways to think about cost sharing between the system and the families who would be using the services. These include no-fee approaches, payments based on current average EC expenditures as a share of income, a basic needs-based budget approach, and an economic demand modeling approach. Obviously, if there are no family fees whatsoever, the full cost of high-quality ECE would need to be covered by other sources. The committee generated illustrative estimates based on families making some contribution. In particular, the estimates that we used assume that families at the lowest level, which we consider to be those at 50% or below the federal poverty level, would pay no fees. After that income level, family payments as a share of income are assumed to increase progressively, which is in contrast to the current system. For families with income between 50% of FPL and 200% of the federal poverty line, the assumed contribution is about 4 to 7% of income. For families with income above 3 times of the poverty line, the income shares are 12 to 15%. So this is in contrast to our current system, where we for sure do not subsidize everyone who's low income, and we provide marginal support to middle income families. And this does approach both the issues for low income and for middle income families. So in this next slide, with those assumptions in mind, this is a look at the dynamic cost estimate to show the resulting contributions from family payments versus assistance from public sources or other private assistance. So here, if we look again at phase 4 in the top row, where it's written total dynamic estimate, 139.9, so that's what we call the 140 billion. And then you look and you see that families are slated in phase 4 to be contributing 58.2 billion, which is 42%. And the public share then would be 81.7 billion or 58%. Okay? So this sort of shows you how we began to look at cost sharing using our assumptions about how you would structure the family contribution. In this next slide, we go a step further. Okay? This next slide, we are trying to figure out what is the gap between the current view of the total dynamic estimate, and again, that's in phase 4, where it says 139.9 billion, the family payment, and now, as you saw, we said on the other slide, the 81.7 billion that is left. That leaves us with the increment that is needed, 52.7 billion that would be needed. How did we get to that? Because we focused basically here on the difference between, what we have in the system, basically projected, and then what will be needed to increase the spending. And we have calculated here how much money from our major federal funding streams and also from our state funding streams is available to try to get at the gap amount to be able to fill the gap. So that's the total that we need to be able to add to the system. I want to move on now to the report conclusions. I noted before that the committee came up with 10 recommendations, and so I'm going to lay out the 10 recommendations for you in this section. The first 3 recommendations are really around an effective financing structure. And there are several components in the first recommendation. The first recommendation is that the federal and state governments need to establish consistent standards for high quality across all ECE programs. The second recommendation is that funding by both the federal government and the state should be linked to quality. And the third recommendation here in recommendation number 1 is that together the state and federal financing mechanisms, and Kathy talked to you about these, both the different ways the mechanisms are categorized here, should ensure that providers are receiving enough money to cover the total cost of high quality. This is a current major problem in the current system to be solved. The second recommendation talks about also access within our effective financing structure. And in this one, as within the first one, there are some subparts here. Recommendation 2 states that access to ECE should be child-centered. That is to say, it should be based on the developmental needs of children and not contingent on the characteristics of parents. To achieve access to affordable, high-quality ECE for all children, first, ECE programs should not set eligibility standards based on parental work status. So this would mean for some of our programs a decoupling of what we have now, where services typically are not available in all ECE programs with subsidy unless there is some parental work or training involved. Second, the federal and state government should set uniform family payment standards that increase progressively across income groups. And you saw that already, the assumptions that we made in our analysis on that, how we set up one way to think about how this would work, and that informed the cost model. And third, that ECE systems costs that are not covered by family payments should be covered by support to providers and assistance directly to families based on uniform income eligibility standards. And then finally, recommendation 3, which is intended to come after other steps have been taken. This recommendation is to take a look at states that have demonstrated readiness to implement a financing structure that has principles of high-quality ECE and includes already adequate funding, and then state government or other state-level entities that would be designated by state government would act as coordinators for the various federal and state financing mechanisms that support early childhood education, with the exception, of course, of these federal and state tax preferences that Kathy mentioned that already flow directly to the families. So the idea here is to basically, without jeopardizing any of our existing federal funding streams, keeping them intact and robust and hopefully getting more resources in them, to also recognize that for purposes of serving children well and for purposes of actually trying to relieve burden on our providers who are managing these multiple funding streams, that we need to up the game at the state level to try to have upstream problem solving here. Recommendation number 4 in slide also are on sharing the costs for high quality ECE. And in these recommendations, the first one, we are looking at sustainable funding for our high quality system of ECE, and within that the federal and state governments would increase funding levels and revise their tax preferences. So you've already seen the numbers that we came to earlier about the levels of funding that we think are necessary. Our panel did not have sufficient time to get into questions of how you would also allocate revenue share between state and federal government. So I just want to bring that to your attention, that this is a more general recommendation to say that this recommendation envisions greater public investment, but without specifying the share that would fall to the states versus the federal government. And next, which I already previewed for you in recommendation number 5, is the issue that families who have the least resources would have no payment obligations, but that if a program were to require payment obligations, then the share of family income should progressively increase as income rises. In recommendation number 6, this is a pretty important one, planning for the transition to high quality. And this is really built on the key principle that we have a big future ahead of us and a lot of big problems to solve, and that our solutions have to be intentional and planful. And so this recommendation is really to recommend that we have coalitions of public and private funders together who would support a first round of local, state, and national, what we call business plans, to guide these transitions towards a reform financing structure for high-quality early childhood education. So these kinds of players could include businesses, employers, philanthropic organizations, along with public funders and other key stakeholders, national or statewide coordinating bodies, interested parents, providers, ECE workforce representatives, and they would be charged specifically with working on the business, financial, and systems strategies that are really necessary to go from a vision to making further progress. Recommendations 7 and 8 are focused on workforce transformation and really strengthening our current incumbent workforce along with the future ECE workforce. Given the current workforce's low level of compensation, the committee felt that asking ECE professionals to contribute out of pocket to their educational expenses or to cover them using loans that must be repaid with future wages is not feasible during the transition to high quality. Therefore, these recommendations are first, that the incumbent ECE workforce would bear no cost to increase their knowledge base, and second, that the entering ECE workforce should be assisted to limit costs to a reasonable proportion of their postgraduate earnings with the goal of maintaining and further promoting the diversity of ECE professionals. Going along with this, we also see that there are a number of grant-based resources for higher education that are currently available from a variety of sources. These resources should be leveraged to help offset the cost of tuition and fees for ECE professionals pursuing higher education. Additional funding would likely be necessary to ensure that ECE professionals are able to pursue higher education and other forms of credentialing at an affordable rate, which we talked about in the previous recommendation part of this. States and localities should work with colleges and universities to provide these additional resources, especially to the incumbent workforce as they pursue additional qualifications as professionals in the ECE field. So the bottom line here with this recommendation is that we need to find a pathway that is workable financially for the incumbent workforce and takes into account the earnings potential for those who enter later on so that it is still feasible for them to participate in the higher education system. In recommendation number 8, this is really speaking about issues for higher education. There is a big lift continued to be anticipated for higher education in the report. Recommendation 8 focuses on improving the quality of professional programs for the ECE workforce. The states and the federal government should provide grants to institutions and systems of post-secondary education to develop faculty and ECE programs and to align ECE curricula with the science of child development and early learning and with principles of high-quality professional practice. Federal funding should be leveraged through grants that provide incentives to states, colleges, and universities to ensure that their higher education programs are of high quality and align with the workforce needs, including evaluating and monitoring student outcomes, curricula, and processes. And I'm coming to the end of my section, then I'll be turning things back over to Kathy for a little bit. But we have 2 more recommendations. And these other 2 recommendations are pretty much, we think, common sense recommendations. The first really is talking about the need to evaluate as we go. And this recommendation says that federal and state governments, as well as other funders, should provide sustained funding for research and evaluation of ECE to ensure efforts to improve the system are resulting in positive outcomes for children and in the recruitment and retention of a highly qualified, diverse workforce. So we wouldn't want to get to the end of this work and have no information about the impact or whether the strategies selected turned out to be reasonable and efficacious in reaching the endpoints. The last recommendation deals with data and data collection and is specifically addressed to the federal government. And it is really around data alignment. And it's really a recommendation to align data collection across all of the current federal ECE funding streams so that we have comprehensive information about the entire ECE sector and sustained investments in regular national data collection efforts from state and nationally representative samples to track changes in the ECE landscape over time. This will enable us to better understand experiences of programs, the workforce, and of course, the outcomes for the children who are participating in the programs. So that takes us through the recommendations. And we do have a slide here that's an overall view around the fact that we can get this done. And we have work to do, and this is some of the significant work, not all of it, that we just talked about. But I think now we were also asked to take a look at strategies for implementing the report recommendations, and I want to turn things over to Kathy to talk a little bit more about that.
Thanks, Harriet. In terms of what states can do now to move forward with actions to support transforming the financing, I've got a couple of examples from my home state of Virginia that I'd love to share with you today. And one is going to relate to recommendation number 3, which is about a harmonized set of financing mechanisms and increased state-level coordination. Earlier this year, through a budget amendment, the Virginia General Assembly required the establishment of a work group to develop strategies and mechanisms for integrated early childhood funding for the Commonwealth. The language in the amendment reads that the Department of Education is to convene the work group in cooperation with the Departments of Health, Social Services, and our Planning and Budget Agency to examine opportunities to develop this integrated early childhood fund with the purpose of more feasibly implementing cohesive and efficient administration of early childhood resources across all relevant agencies and revenue streams to increase access to quality early childhood services for at-risk children. The work group is to articulate the potential for fully leveraging existing but underutilized appropriations and to identify how newly deployed funds could generate enhanced outcomes and bring a return on investment for the Commonwealth of Virginia. The language has a report due by October 15th of this year to a legislative subcommittee that will be timely for any relevant action and budget preparations for the 2019 General Assembly. One item to note, in both of my recommendations, examples for the recommendations are talking about state-level action that could be used and that also relate to how private organizations can participate and support these actions. So in the case of the Integrated Early Childhood Financing Work Group, the Virginia Early Childhood Foundation, a private nonprofit organization, was written into the, both prompted the budget amendment and is written into it to provide for the facilitation of the work group. And then secondly, an example related to recommendation 6, which is around building system-level workforce development strategies and supports for the early educator workforce. Virginia has taken several interrelated steps, and all under the auspices of the School Readiness Committee, which is a standing committee in Virginia statute with the purpose of ensuring that our early educators have access to a competency-based, stackable sequence of education programs and relevant certificates and degrees across our institutions of higher education. These steps include, first of all, ensuring that we've revised and updated standards of the profession that reflect the most recent practice research and are aligned, in fact, with the standards outlined by the National Association for the Education of Young Children. And based on these standards, associate, baccalaureate, and postgraduate degree programs in our colleges and universities reflect and support the mastery in the skills, knowledge, and competency for teaching children birth through age 8. Next, the colleges and the universities have worked together to design associate degree programs with a concentration in early childhood development that emphasize the birth to 5 continuum that will seamlessly articulate to baccalaureate programs that feature this concentration in early childhood education. All of the Virginia community colleges in our system have agreed on the common set of coursework that make up this associate degree so that individuals in any locality of our state have access to a campus or online coursework with 2 certificates that stack neatly toward achievement of the associate degree. Several Virginia universities have then designed their baccalaureate and teacher licensure programs so that 2+2 agreements can guide a seamless pathway for these educators who wish to go on and strive for a bachelor's degree, so that the cost of the education doesn't present a barrier for teachers, assistants, and administrators who, of course, make notoriously low wages. Virginia dedicates state general fund dollars of $1 million annually in supplement to the federal scholarships and financial aid so that the courses, fees, and textbooks are covered for early education. These scholarships support students who are dually enrolled in high school and community college programs in early childhood, and for incumbent practitioners in all different types of early learning programs across the state. And then finally, an early childhood apprenticeship program is being piloted to field test strategies to raise the compensation of early educators who reach the benchmark in their educational and their practice achievement. As with the first example, the private sector has served a role as partner to the public institutions by the Early Childhood Foundation, providing for the facilitation of the School Readiness Committee itself, of the 2+2 articulation pilot work group, and by administering the scholarship and apprenticeship program. Harriet, I'll turn it back to you to give a few more examples.
Thanks, Kathy. So I'm going to start by talking about this question of state-level coordination and what that might look like, what states could do. So one of the areas that comes to mind is actually here around state-level governance and how states are treating and thinking about their current ECE programs. Are they looking at these as a disparate set of programs or as a unified set of programs? And that is not to say that all these programs have to be consolidated into a single governance unit, because that is one but not necessarily a complete solution or the right solution. But states could actually drill down further and really take a look carefully at the programs which they exercise the clear authority over, namely state pre-K and their child care programs, and really take a look at what they have done to assure that these programs are really operating from the same standards and the same resource allocation strategies and the same support level of strategies. And as an example, typically when states look to uncover at the per child cost, like an hourly cost if you reduce their pre-K and child care programs, you can see very large differentials in terms of the payment levels for the children. And at the same time, you can also see that they often have a different point of view about what is required for the teachers and a level of supports in those settings. So that is one area where states could actually begin, independent of anything else happen, to basically focus on the workforce and on the compensation of the workforce and on a more consistent quality view across their programs. The second one is recommendations around state-level cost modeling and financial forecasting to assess the cost of policy options. And one of the things I hope that you heard in listening to this was that in this area, we built a national cost model, and it's an illustrative cost model. There are assumptions. We've tried to be clear both in these presentations and then for those of you who take a look at the deeper report about the assumptions were made. States actually are not all the same. And so trying to figure out what a cost model would look like in a particular state really requires people from that state to come together and to estimate. You can't just derive a number from the national cost model that we did. And so that's a prime area for people to say, take a look at where do we intend to get to, potentially as we built in our cost model phasing. So that includes, for example, phasing in to the BA. We don't go from a workforce where we don't have everyone with a BA to having our lead teachers basically with the BA immediately. So this is a really important area for those who see this report as trying to say, let's set a mark in terms of where we're going, both in terms of the level of resource we have to get and also some of the structural changes we have to achieve. So that's another area that I think is ripe for state-level action. There are a couple of states and some regions that have engaged in this kind of cost modeling. It's a little bit different when people take a look at, for example, often in their QRIS, people will take a look and see whether they think the QRIS is implementable within the resources, and that generally leads to some gradual adjustment. This is really looking at the bigger picture further out with a higher aspiration level for the cost model. Next one I just want to touch on briefly is around higher education. Kathy talked, of course, about her good experiences in Virginia, beginning to work on higher education. And the only thing I just really want to mention here around higher education is that all the data we have, this is information we have from the first Transforming report and also from other subsequent studies, suggests that there is somewhat of a mismatch between how higher education is serving people who are going to be early childhood educators and what their needs are. And this is most acute, of course, with people who are going to teach infants and toddlers, who are largely left out of the preparation systems. Community colleges tend to do a more focused job for this population. So there is clearly work here to be done to take a hard look at all the different places in a state where early childhood educators are getting their AA and BA education, whether those are sponsored through human development, sometimes through recreation, through traditional teacher ed programs. There's a lot of disparate work going on that needs to come together and be harmonized. And then there are questions, of course, here that states could begin to work on as you're really trying to zoom in, as we did in this committee report, on educators teaching infants, toddlers, and preschoolers, is how our certification and preparation programs are really serving them. Higher education will need a lot of support to be able to add in the levels of expertise and perhaps new ways of rethinking its own work. And then the last one that we just wanted to touch upon for you briefly is around compensation approaches and work that states might be able to do to stimulate improvements in compensation. As I think we talked about in the report, there has been somewhat greater progress in this group of infant, toddler, and preschool teachers amongst the preschool teachers. There is some parity work that is happening within state pre-co programs that people have to build on. But there are a couple of things states can take into mind, and this is a really short list on compensation, but some ideas are to actually build compensation bands and expectations in a very public way. We actually tend to do this more in pre-K, where we tend to publish and sort of say what the expectation is, less so actually in our other early care and education services that we're offering. So those could be built, for example, into state career lattices or ladders, however states are defining those kinds of things. Another piece, as I said, is public benchmarking to go along with this. Another relative to QRIS would be to actually build some of this into QRIS, so it becomes part of the structure or the frame or the expectation for the work that is happening. And then the last that I want to say is for people to actually begin to implement compensation strategies directly into their child care and into their pre-kindergarten programs, which does require putting more money in, along with these kinds of benchmarks and calling this out. And there are specific ways that people can do that. There are experimental ways, but there are ways to do this within payment structures and strategies within QRIS. there are ways to do this within benchmarking or contractual strategies within how states are delivering pre-K, and increasingly, as we've seen in some states, how states may be using contracting mechanisms to now try to develop out their infant and toddler programs that would make this amenable. So that's a little bit of an overview of some things. There's a lot more that we hope states would be able to think about in terms of taking this report from a book into something that really might be able to inform good work at the state level as people seek to move this agenda along. So I think that concludes our formal presentation.
Okay, thank you, Kathy and Harriet. Now we'd like to open it up to questions from all of you. If you have not already sent any questions that you have during the webinar, please feel free to go ahead and drop any questions that you might have into the Q&A box. We're going to try to get to as many questions as we can with the time that we do have remaining today. Before we do dive into the questions, I just wanted to mention that after the webinar, we will send out a stakeholder feedback survey to all of the webinar attendees through SurveyMonkey. So we would appreciate receiving your response to that survey, so please do keep an eye out for that survey in your inbox very soon. So let's turn to the first question for Harriet. You described 4 phases for implementing the high-quality ECE system. Can you describe the 4 phases and how long you anticipate each will require to roll out? Are there any target years or expectations about the timeline for movement from phases 1 to 4?
Sure, that's a great question. So the idea of the phases wasn't for us to delineate specific years as much as to make the point that where we are today, we are quite far from where we would like to be at phase 4. And so the idea of phases was really to try to convey the concept that you can plan and make change in chunks. And I think I've already given this example. If you want to move the workforce, the core workforce to a BA requirement, that's not achievable overnight. And so our cost modeling took that into account, basically in terms of how we approach this. But wasn't our intent to really say how long everything would take, or how long each phase would take, more to say that it would be important to think about this in terms of phases in order to get the work done. I don't think we're thinking about lifetimes of work, on the other hand. I think, we all wanted to see a future basically to accomplish this work that wasn't over decades and decades.
Okay. Someone asked, did the committee address the challenges of achieving a major commitment of public investment? And that's for Harriet.
Okay. Yes, there is verbiage in the paper. And so I do encourage, hopefully Kathy and I have made this interesting enough that you're going to want to read the paper now. But right inside of our report, we have a discussion about the fact that ultimately, as we're saying, we can't just redistribute resources. We need to actually get more resources into the system, and that regardless of what you decide about the financing mechanisms, the reality is political will is also involved in growing the level of public investment. So we have acknowledged that within the paper and understood that that is part of the planning ahead, and that that's a critical piece of the work that will have to be done to get from where we are now to where we would like to be.
Another question asks, you mentioned states acting as coordinators for the various financing mechanisms. Could you describe what this would look like in practice? How does it differ from what states do currently?
Do you want me to answer that, or Kathy, do you want to take that one?
I think you gave some good examples, Harriet. Maybe you could expand a little bit on how states could serve as those coordinators.
Sure. So one of the things that I think that, we said is this report doesn't envision us getting rid of any funding streams. People have worked very hard to get the funding streams we have. But we also know, because we do have, just looking within the states, multiple funding streams, and looking within the federal level, multiple funding streams at all as well, that sometimes when we talk to providers and we talk to families, we know from talking to them that we haven't made things as easy for them as we might wish to. And we want to facilitate family access, and we also want to basically have providers principally focusing on delivering high quality services and not on lots of backroom office and business operations. So the concepts here around state coordination are really done with the idea that because we do have these multiple funding streams, we need to actually basically and concretely try to smooth things, as I said, upstream more. And I did try to give, some examples around this. And so an obvious one that is important here, because we're workforce focused, is let's say that you want to move everyone, your lead teachers, to a BA. And many, but not all states, of course, already have that as a standard in pre-K. And very few states have that as a standard within their child care program. Some may have it for a portion of their teachers within the QRIS. So to get from here to there in that kind of thing requires actually better coordination at the state level. That's not doable unless you actually are coordinating both within whoever your state agencies are who are overseeing the programming, child care and pre-K, along with higher education. And you have to find a more sophisticated way and a more intentional way to realize that kind of goal. You have to come to greater clarity around what are the like aspects of these programs, and then around your support strategy to get from here to there. So I hope that's helpful in trying to think about what that work is. Now, that is not to say that states aren't doing some of this work now, because I think this question is, how is this different from what we have? States are in very different places all around the country of the degree to which they seek to work in multiple organizations across. And there is, I think, virtually no state where we can say, again, just using this one example, that an underlying assumption here is basically the movement of our workforce to our lead educators to a BA, who have really embedded that squarely in all of their early learning programs. So that's both a policy change and a coordination issue as you're trying to look at these. So I hope that's helpful in terms of saying there's good work states have already done and are doing, but there is more of it to be done, and not every state is in the same place at the starting point either. I think, want to mention here that on some of this coordination issue, the federal government, of course, is getting ready to release the preschool development grants, and I think this is expected to be a significant feature, basically, of the preschool development grants, which are now part of the federal education law. And so there are some things, I think, from this report that may be useful to states is thinking about as they're thinking about what would it mean to have resources now to kind of go to another level in terms of how the service delivery system is designed and really working for the children and families that people are trying to serve.
Another question for Harriet. How do the recommendations and financing address the working conditions for home-based providers? For example, they work with multiple age children, they do not have paid planning or training hours, work long days, 5 days a week and year-round. How do the recommendations take their experiences into account?
Well, the good news is that we know all that, and that we provided basically for the same attributes for home-based providers as for other types of providers. In other words, when I gave you that slide earlier where we talked about our assumptions and we said who are the people, how are they educated, do they get planning time, those assumptions were then applied to home-based providers as well. So that does obviously increase costs. Now, costs for home-based providers do vary in part around the age of the children, and we built some assumptions into the model about what the age bands would be, but we didn't assume that home-based providers would only have one age of child, because as the person who asked this question, he knows that's not typically the case. They'll have a wide range of ages of children. But we try to apply the same expectations or standards in the system as a whole so that this greater support that I was talking about is envisioned as serving both the center-based and the home-based community.
Someone asked, could you describe how employers might participate in funding early care and education? Kathy, could you take that one?
Sure, glad to. The committee took a look at and could not find satisfactory numbers in terms of the amounts that the employers contribute currently to the cost of ECE, but in general found that with the numbers found, the contributions of philanthropic and employer organizations accounted for probably 2% of the total cost. So it's not an enormous share that is documented, but probably an important area to focus on. There is a section in the report that looks at the ways that employers as stakeholders in the private sector can contribute, and typically those employer contributions are in the form of employee benefits or incentives like an on-site ECE program in some cases, R&R, resource and referral services for finding ECE providers for working parents, or support for quality early care and education services through direct contributions to ECE service providers. Paid family leave policies is another way that employers can really contribute, and there's a more lengthy section on paid family leave policies in the second chapter of the report. The committee grappled a little bit with considering about how employer-based early care and education subsidies could be viewed as supporting the cost of ECE services for employees, but that often those contributions are a component of their employee compensation. And so we're concerned that at least some, if not much of the cost that's associated with those types of benefits could be borne then by the employees themselves in the form of a lower cash compensation. But in terms of employers being counted as contributing to the cost, at least a portion of that contribution would be, more a cost borne by the employees themselves as foregone cash compensation. That because public spending on ECE comes from revenues from taxes on both individuals and businesses, in this way employers can also be seen to be indirectly contributing to ECE spending.
Another question for Kathy. How can state quality rating and improvement systems better support a transition toward financing a high-quality ECE system? What QRIS policies should states consider?
My recollection of the conversations that we had among the committee was that, we saw that QRIS is a promising strategy in states, but there is limitation in at least two ways to current QRIS systems in states. One is that there's generally inadequate operational funding for robust systems themselves in states, and that limits them from being the really robust reform strategy that that has been intended and I think that we've hoped for. And also lack of financing or inadequate financing structures in states to address the result of the ratings to enable providers to meet higher quality standards in and of themselves, especially when it comes to a well-qualified and adequately supported workforce, and then also to enable parents to afford highly rated ECE. So again, a promising strategy, but systems that need a great deal more financing and more stability and sustainability in the financing to really, come to fruition.
How do families needing evening and weekend care to fit their work schedules fit with this scenario? This is also a question for Kathy.
I think that we addressed those sorts of issues and questions when we took a look and really established our fourth principle, which was looking at ways to identify a variety of service delivery options that are sustainable and that are provide options for families' differing needs. And one of the ways that we found that could be useful in addressing that is to rethink or redeploy provider-oriented financing, which currently is mostly directed to center-based providers and for whom offering care during these non-traditional or non-standard hours is not particularly cost efficient. But if we were to rethink or utilize those financing mechanisms in a way that incentivize providers, we might be able to generate those and support those that are willing to offer services during non-standard hours, and hopefully also be supported with adequate funding to be able to offer services for longer durations and, again, just be more variable to better meet the need for some working parents.
We have a few additional questions focused on the financing model, so these will be questions for Harriet. The first is, does the $140 billion total dynamic cost estimate include the cost of educating the incumbent workforce? If not, did you estimate what that would be?
Yes, we included these systems costs in our model.
Okay. The next question, can you explain a bit more about the sub-parity wages that you use to calculate salaries for ECE providers? What was the thinking for not using full parity? What was the thinking for not using the full? Let me just finish the question because there's a few sub-questions involved with this one. So what was the thinking for not using full parity with K-12 if they are BA level teachers, and what percentage of K-12 wages was used?
Okay. So I think the first question is, what did we use? So what does sub-parity mean? I recognize everyone on the call may not be totally familiar with these definitions that people have been creating. So sub-parity means that we took the teacher's wage, the K-12 educator wage, or the early elementary educator wage, and that teacher, of course, is working not the full calendar year, right? And so that wage basically got spread across the full calendar year because we did assume in here that our families are going to use access 12 months of the year to the services. So that's what we mean by sub-parity. And as I said, the differential here is the 10%. That if you want to know what this calculation would have been, you take the $140 billion and you add 10% to it, and that would have given you full parity. The second question really was, how did we make this decision? And at the beginning of our conversation with you, Kathy and I both talked about how the committee actually operates by consensus. And the committees, they actually make a great deal of effort to bring together people who do not all see the world the same way. And so the decision basically to calculate and include in our illustration sub-parity, and then to also include the additional information about what the additional costs would be for full parity was really done through our consensus process. I think there was a third part to that question that I lost. So if I didn't fully answer, remind me of the next piece I need to answer. Oh, I know, it was, how did we look at the wages of the educators? So we pulled from the national data that we had, and I think this speaks to this question. When we said, how does the $140 billion relate to your home state? You have to actually do your own cost model. You could use the assumptions of ours or change them. But we basically were using nationally available data to basically look at what that educator compensation level is in terms of the lower grades of the K-12 system.
Okay, we have one more question. I think this will be our last question. This is also for Harriet. How did the financing model account for staffing levels? What assumptions were made?
Okay, I hope I can understand this question. So you're talking about like the types of teachers. So I think this is a pretty comprehensive staffing model that we used, and we do actually have some pretty good tables and charts in the report that show you what these assumptions are in terms of our lead teacher and our, I actually was able to open to one of them so I can read you. So we have our lead teacher, we have assistant teachers, we have aides. So we've tried to appropriately account for staffing patterns. We tended to use, in terms of group size and ratios, the national recommendations. There's one change we made in these, which interestingly enough is around preschool, because we ran the data around preschool in terms of what have we accomplished in the nation as a whole in terms of our preschool group size and ratios. And we saw that we weren't quite at the national recommendations, but that we determined to use kind of where people were, which are just short of the national recommendations. So we made some changes like that, but our staffing patterns, as it were, account for a full array of individuals who would be necessary to deliver high quality services. And we also ran in this model, and I do think this is important, when we made the point that we know now that things that may be actual things in the K-12 system, planning time, they're not typically available to teachers in the birth to 5 system. And they're for sure not typically available to people in childcare. So our staffing model actually takes into account how you have to staff a program. And someone asked about family and, before, both family and center, in order to basically be able to enable the staff to have those. So I hope that's responsive to the question in here, but when you go dive deeper into the paper, you'll be able to see, again, tables and things where you can see how we looked at our educators, who is our educator complement, what are the degree levels that we're assuming for them, how do we take into account basically our ideas about that really came from transforming the workforce, around supporting teachers as professionals, as well as other staff that we are assuming become part of the operations of the program.
And we actually have one more question. How does the model apply to rural and tribal communities? Is there any sense about how preferences for care might change, how challenging it might be for ECE teachers to have the resources and system support? Is this one that you might be able to tackle, Harriet?
Sure, I can tackle that at a high level, but I think I've given the answer. People might not be surprised when I say this. So the illustrative cost model took all the national data. So for the country as a whole, it does include our rural communities and our urban and rural and suburban and tribal communities, okay? But that is not to say that the assumptions would play out precisely the way they look in the national model at the state level. And so let's give the example that has been one we've heard a lot in the presentations around this shifting, not the decimation of family child care, but the shifting that we saw. That might not be accurate in any one person's state, right? You have to look at your current base of children and families and culture and expectations in the community to try to figure out what your go-forward strategy is going to be around where you end up in your diverse delivery and what your balance is ultimately of your center and home-based solutions. The report does assume, and I want to be very clear about this, that diverse delivery is the name of the game, that you're going to have multiple types and forms of players. And Kathy talked about that when she answered the question about meeting the needs of families who may have non-traditional needs for services. So that portion is included. I think that if the question is also around things like educating the workforce, right, there is a whole section in here that really in many ways was saying we need to support higher education to innovate and to be able to be responsive fully to all of the incumbent workforce and to have an approach that will help us prepare a next generation of workforce who is going to be willing to enter the field. Now, in part, we assume willingness to enter is that we develop better payment mechanisms and payment levels for the people. But I think that we tried, without trying to take the place of other work that other people will have to do, at a high level to take into account that the level of accessibility, quality, and availability that we're striving for, and there's language in the principles around this, is really meant to be a strategy that can actually work in all of our communities, not just urban versus rural or suburban, all communities, and children of all income levels, and children with very different ranges of needs and possibilities in their lives.
Okay, thank you. That was our final question for today. If you have any additional questions, feel free to reach out to our presenters using the contact information that you see noted on the screen here. I'd like to thank our speakers and then also thank all of you for participating and sharing your questions with us today. I'm going to turn it over to Brian for any final words before we sign off this afternoon.
Thank you. Please be on the lookout for an email about the survey. Please fill out the survey. We need that information. This concludes the webcast for today. Have a great afternoon.